Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and neurosurgeon Dr. Thomas Nowak. We have an exciting show lined up. Let's get right to it. If we told you that there's a simple 2-shot vaccine to prevent a highly deadly cancer from developing over your lifetime, would you get it? Well, joining us to discuss is our friend, Dr. Salvatore Giorgianni Jr., founder and VP of Healthy Men, Inc., and the Senior Science Advisor to the Men's Health Network. Thank you for joining us yet again.
Always my pleasure to be on the program, Kimberly.
Certainly. So, Dr. Sal, first off, can you explain what HPV is, how it's transmitted, and what some of the symptoms are?
Yeah, HPV, it's one of those acronyms we love in medicine, which is human papillomavirus. It's not HIV, and sometimes, unfortunately, people mishear it and they get confused, but it's a completely separate sort of thing. It is a sexually transmitted type infection, which can be easily transmitted with any sorts of sexual contact, including what some young folks don't consider sexual contact, which is oral sexual contact. The symptoms of HPV infection can be pretty generalized, and you can see it manifest as warts. They can be sort of genital warts. It can be a common wart virtually anywhere in the skin. You can see it as a plantar wart on the foot, and you can see it as a sort of a flat wart that'll be almost any place. The big danger from human papillomavirus, HPV, is that it can lay dormant in your system for up to 30 years, we think, maybe more. And this virus is one of those positive agents that can cause deadly cancers in both men and women. Cervical cancer in women is very common. Oropharyngeal, that's throat and neck cancers in men and women are very common. Anal cancers, penile cancer. So it can cause all sorts of cancers up to 30 years after exposure to that virus. So it's something that is very, very, very easily managed with a vaccine. And that's why this is an important program.
Has HPV gotten worse over time?
I don't know that it's gotten worse. I think that we have more transmission because the ethos and the sexual activity of individuals has increased over time, and people becoming sexually active younger and younger, and even older into old age. There are the ED medicines now, and it's quite possible that this type of thing will transmit when you're over 60 if you contracted it in your earlier years. So the incidence of sexually transmitted infections in general is increasing, and this is no exception. Most do not cause cancers. This one does.
And how young are they saying to vaccine children?
Now, that's a very important question. The recommendation from the FDA, CDC, currently is from 12 years on up to 15 years. You need a 2-shot regimen spaced out over a period of 6 months or so. If you're over 15, you need 3 shots, and you can get this, and it'll probably be effective up until about 25. Some clinicians feel 45. Now, there are many, including myself, who believe that children as young as 9 years old should get the 2-dose series because, unlike some vaccines, which people know all too much about, this is a simple 2-dose regimen that'll cover you for life, as far as we know. Unfortunately, the vaccination rate against HPV-related cancers is only at about 38% for both males and females, boys and girls. We need to get that number up. So here again, the top line is, if I told you we have a vaccine to prevent cancer in your lifetime, do you think only 38% of the population would get it? No, but for some reason, because this is linked with sexuality, people were very reluctant, particularly parents, to get the vaccine for their kids.
We'll have more after the break. You are watching American Medicine Today.
Two neurosurgeons couldn't figure out anything that was wrong with me or what I would need surgery for. Dr. Bonati, without even seeing me, knew I was hurting, knew they could help me. First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Visit askbonati.com. Welcome back to American Medicine Today.
Now, Dr. Sal, how much of that do you think is sort of this? Obviously, we saw a lot of this come about with COVID. People were vaccine hesitant. And not only that, there were people that were straight up anti-vaccination in general. So how much of that plays into, I mean, do you have any of the figures from, say, pre-COVID? Like, have less people decided to take the HPV vaccine since COVID because of all of this stigma around vaccines, and how safe are they?
Yeah, we do have numbers pre-COVID on this. And it's just as bad then as it is now. Still, there's a very underwhelming response, receptivity to it. So a lot of us believe that part of that is, again, stigma of sexuality. You talk to a new parent, a 9-year-old boy or 9-year-old girl's parent, we want to protect your son and daughter against a sexually transmitted infection. And they say, oh, what are you talking about? My child is not sexually active. But they miss the point, which is we want to vaccinate them now because they will become sexually active.
Are there any side effects?
Yeah, there are side effects to everything that we take in. Side effects to too much water, of course. But yes, I mean, the side effects, though, are the type that we generally see with most other infections, which is irritation, inflammation at the injection site, some discomfort. But the other sorts of things that people are worried about because they've been in the media with the big COVID vaccines, which are coming up again soon in respiratory season, they have not been seen with the HPV vaccines. They are very clean vaccines. They're not mRNA vaccines. They are traditionally produced vaccines, so that no Guillain-Barré has been reported. And part of that is because kids have very, very good immunologic systems, and they can tolerate these things very well, which is another reason to get those vaccines early.
You were telling us before the top of the show about a podcast you just started. Can you just quickly tell people the name and where they can find it?
Yeah, my organization, Healthy Men Inc., has started a program on the American Forces Network. It's called The Healthy Family Show. And here we focus on the health of the entire family, moms, dads, grandparents, kids, uncles, because it's all interconnected. And it can be found on the American Forces Network.
Thank you so much for being on the show yet again, Dr. Salvatore Giorgianni Jr. We appreciate your help trying to keep the country healthy.
Thanks,
Thank you.
Dr. Sal.
My pleasure.
Take great care. We'll have more after the break. You are watching American Medicine Today. Stephen spent a lifetime of performing physically demanding labor in the construction industry.
I love to fish. I like to go to Canada at least twice a year if I can. And we have a place up at Prairie du Chien, Wisconsin, in a mobile home that we like to use as often as possible. Spend time with our 3 children and our 3 grandchildren. My pain actually started in February, and the cause, I don't have anything to really put, there was no accident of any kind. It went on, it started going down from my lower back into the back of my legs, through my buttocks. Then it went down and caused numbness in the bottom of my feet. And that's when I decided that I really needed to go see somebody when it started, my feet were getting numb.
When his pain wasn't going away on its own, he tried conservative treatments. When those didn't offer him any relief, he went to the Mayo Clinic near his home in Iowa.
I decided to try to manage it myself with chiropractic, with massage therapy. And then I saw that it wasn't really helping as often as I was going, so I increased that. I did try physical therapy twice. That didn't help me at all. I went up to the Mayo, and they, after interviewing with them, I want to go their route because theirs wasn't a minimally invasive. It's going to be a longer period of rehab, along with using a walker, along with maybe going to a rehab center. And I wasn't ready to do that.
That's when a chiropractor recommended the Bonati Spine Institute.
Filled out an application with them online, and then I got a call from them for some more information. I had already done an MRI that had been done by our local neurologist there in Waterloo, Iowa, and he sent all of his information here. Catania several times reached out and let me know what was going on. And yes, Dr. Bonati did call me personally. It was kind of interesting with what he had to say because he actually told me what my symptoms were.
When you walk, when you're sitting like that, you are some sort of okay.
Yes, okay.
But when you stand up and start to walk, you have pain here.
Yes, big time.
And if you keep walking, the pain goes to the hip.
Yes.
You keep walking, goes to the butt. You keep walking, the knees fail. You need to sit, wait a little bit, you can walk a little bit again. All right?
Right. They went over all of my MRIs that they had here. They could show me where my issues were, and they were going to relate to me kind of what they would do, and it was based on 3 minimal invasive surgeries at that time. It was my L3-4, L4-5, and then L5-S1.
The exclusive Bonati Spine procedures are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure their source of pain is eliminated.
I could always hear kind of what they were saying, but what they would do is they would ask me questions as they were working on my back, and I could hear and answer questions that they would have as they were working.
No pain here.
Got it. No.
No pain here.
No.
No numbness on the foot.
No.
No hip pain.
No.
You're set.
I was walking, I would say probably maybe 100 feet right after my surgery. They did, like I said, took my vitals, and then I was able to go home. After the first one, got the numbness was gone in the bottom of my feet. Well, one of the, I think when I get back to my house, I am going to do a lot of walking. They tell me that that's one of the most rehabilitable things, being rehabilitated, I guess you could say, to be able to walk. And before, I was lucky if I can make it out to our mailbox at the road and back without pain. But walking is going to be more on my agenda than anything else to rehab of what I have to do.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Well, that's all the time we had for this edition of American Medicine Today. You can download our app, search American Medicine Today, and add us to your favorite channel streaming lineup. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.